In the United States, there are federal and state laws that require healthcare companies to report their interactions with healthcare professionals. This is called the Sunshine Act, which sheds light on the financial relationships between physicians and teaching hospitals with pharmaceutical, medical device, and biotech companies. While compliance regulations are now becoming the norm globally, they have been instituted as a way to improve compliance-driven marketing, transparency between industry and physicians, and cost management. Healthcare exhibitors, as well as healthcare associations, and both for very different reasons, need to be aware of the timeline for implementation of the Sunshine provisions in the 2010 Federal Patient Protection and Affordable Care Act. The final rule released by CMS, or the Center for Medicaid and Medicare Service, in February 2013, identified the following key dates for data reporting. August 1, 2013 is the start date for collecting and tracking data. March 31, 2014, all data must be reported to CMS, and September 30, 2014, data will be published on a public website. In future years, this date will be June 30th. So who is required to report? Both applicable manufacturers, as well as group purchasing organizations, or GPOs, must report payments to covered recipients. Covered recipients are defined as doctors of medicine and osteopathy, dentists, podiatrists, optometrists, and chiropractors. Teaching hospitals are also included. The requirements of the Sunshine Act provisions are many. Given the complexity involved in the implementation of the Sunshine provisions, convention teams, healthcare associations, and the legal and regulatory departments at these organizations need to be aware and familiar with the entire Sunshine Act, not just the highlights in this video. When tracking and reporting data, the following items of information need to be captured: the GPO's or applicable manufacturer's name, specialty, address, MPI number, and state license number, amount of payment or transfer of value, date of payment or transfer of value, form of payment, for example, whether it's monetary or in kind, the nature of payment, such as consulting fee, gift, or food and beverage, and the name of the related drug, device, biological, or supply. Remember, reportable transactions cover any number of items, so be sure your organization is familiar with all of them. An important item to note is that aggregate tracking is a vital component of the Sunshine Act tracking requirements. Transactions under $10 are excluded, but in aggregate of over $100 they must be reported. Exclusions to the Sunshine Act are defined as items that directly benefit patients or are intended to be used by or with the patients and are not required to be reported. Exclusions from tracking and reporting include transactions under $10, payment to medical residents, $100 per year aggregate, education materials that benefit patient use, product samples for patient use, discounts, rebates, product warranties, short-term equipment loans, indirect payments, provisions of health care, and in-kind items for charity care. CMS has developed 2 free mobile applications to aid both physicians and industry in tracking data collected. The applications are available for Apple and Android devices and provide a number of benefits, such as a resource to track payments and transfers of value real-time, a resource for historic data, allows physicians to update their profiles for accuracy, minimizes the risk for inaccurate data reporting, and also allows physicians to receive information from industry. HCEA, or the Healthcare Convention and Exhibitors Association, has links to these resources at www.hcea.org. An important distinction is that the Sunshine provisions are law, very different than, let's say, Pharmacode, which is not law. Under the Sunshine Act, financial penalties will be assessed for inaccurate data reporting as follows: a civil penalty of not less than $1,000 for inaccurate reporting, but not more than $10,000. The total cannot exceed $150,000. There is a clear distinction between inaccurate reporting and failing to report. A civil penalty of not less than $10,000 for knowingly failing to report data, but not more than $100,000. The total cannot exceed $1 million, and combined cannot exceed $1,150,000. As was referenced earlier in this video, information will be published on a public website for review. Ensuring that your company is complying with the regulations and provisions included in the Sunshine Act will be beneficial, as the public and the media will be provided access to this information beginning in 2014. Scrutiny will begin, so be sure you are in the know. Covered recipients include all physicians, unless employed by manufacturers, and teaching hospitals that receive Medicare payments for indirect medical education, IME, graduate medical education, or psychiatric hospital, IME. Those that are not covered recipients are non-physician prescribers, such as nurse practitioners, residents, and non-healthcare departments of universities affiliated with teaching hospitals. The Sunshine Act is a complex federal regulation. As this process unfolds, we will continue to have questions and learn more about potential changes and refinements. The Healthcare Convention and Exhibitors Association is an excellent resource for information affecting those that work in the pharmaceutical, medical device, and biotech convention marketing, exhibitions, and meeting industry, as well as those that work for healthcare associations. This short video should not be used as substitute for legal advice, but rather as a resource to stay updated and in the know on issues that can seriously affect your organization. Please visit www.hcea.org for additional information and resources about the Sunshine Act, such as HCEA's Sunshine Toolkit, and other valuable resources to help you face the challenges affecting the healthcare convention marketing, exhibitions, and meeting industry.